Hello, everyone. I think we're still waiting for people to join. I mean, we have Miljan, Uros, Maria as well. Let me check who else from the... Lizzie was unable, Megan was unable to join us. So I think we're, and I don't know if Persephone will be joining us here. But otherwise, I think it's, we're all here. So we can start our panel discussion. So are there any questions for any of the presenters?
I would just give a few more minutes in the case somebody comes in.
I'm going to start with Miljan, just because it was the first full presentation that I was able to see, and then we will move for questions for Maria and for Uros. So Miljan, I found that it was really interesting, this idea of gamification.
Yes.
And, you know, you were talking a lot about lots of concepts about VR, AR. I personally worked quite a lot with that because I also come from an architecture background. So we've been working quite a lot with this idea of the digital, you know, digital elements applied to, you know, to other disciplines. But I would like to know more about how does gamification and these techniques have had an impact in your own practice and in your own work?
Well, my PhD dissertation was about augmented reality, using the same technique with the paintings and scanning them and open the 3D virtual space where the audience can discover the whole world virtual. It's about 360 degree across the view. And now I'm working with this gamification process where the participant can be more active.
Do you mind turning your camera on, please?
Okay, I'm in the kids' room.
Oh,
it's
okay.
pink.
Okay. If you don't want to, don't do it. It's fine.
I can if you want. Well, yes.
Sorry to interrupt you. Just continue, please.
Okay.
Disregard.
My PhD was about the classic virtual three-dimensional worlds, and now I'm using the gamification process to be a bit more interactive with the space, with that virtual environment, when the users can move objects, play with them, create something new on their own.
Yeah, no, what I found interesting is that your practice is more within fine arts, but actually
Yes.
the fact of introducing these techniques, it makes your work performative because, you know, it seeks interaction. So it becomes something that where audiences work around it and interact with it. So I think it adds a performative dimension, and that's why I mainly find interesting that actually the final product, no, it's just not about the process.
Yes,
the final product, it becomes something different, like a different media. So
the interaction is at the art exhibition, where the user scan the picture, open the game, and play in the exhibition space because now everybody just looking at their phones, and now they can that way participate at art exhibition.
Yeah, that's really interesting. So does anyone else have any questions?
So I have a question. This is for Persephone. I'm interested in the future of digital performance as a method, a way of dealing with children health. I've seen the films you prepared, and they're very emotional. And they're on YouTube, and they're what would be the next step to take that experience and then create some kind of a platform that could be used as a as a way, as like, we use yoga or we use certain medication. Now we use this platform.
Thank you, Alexander. Oh, that's a great question. And I don't have a crystal ball in front of me to give you the answer. Well, I think that there is a lot of scope and a lot of potential for performance in many different forms to have a positive impact on children's health and well-being in healthcare and social care settings in the UK and abroad. And by healthcare and social care, I also include hospitals, hospices, and palliative care for children and young people who are suffering from long-term and terminal illness. I could easily say that what I think we need to do next is to become more creative in our collaboration with the healthcare sector. We come from a culture that is artistic, it's educational, it's impulsive, passionate, imaginative, but we enter the healthcare culture as outsiders, which is not necessarily a bad thing, because we bring this fresh new approach to healthcare. It's important to remember that the quality reports of NHS trusts and the most recent ones in 2020-2021 all mention the need for quality of care, and they all put the patient, the children, their parents, carers, and families at the center of the healthcare provision. There is a lot of literature and a lot of paperwork that one needs to complete for PPI, for patient participatory engagement, when we enter the healthcare culture. And we need to find new ways for this marriage between the arts and health and well-being to work. I've been through this for many, many years when I first introduced bedside theatre performance for children in hospitals in Greece, here in England, in Poland, and since 2018 in Australia. And it's not an easy job to do. We speak different languages, we reference in different ways when we come to academic writing. We have different understandings because of the background and different prioritizations. For them, for the clinicians, children and young people are patients. For us, they are audiences. And that's a shift of identity and a shift of power. For hospital teachers, those children are just pupils. So trying to find the right ways of working with others and combining our specialisms, combine our expertise, performers, artists, directors, digital artists, those who have the brains of technology, together with clinicians, doctors, nurses, applied health professionals and practitioners, and those who make policies. Policymakers are really important if we want to move this forward. So just to summarize my answer, because it was quite a long one, collaboration, understanding of each other's background, priorities, aims and objectives, and a willingness to see how we could work together so that digital performing arts could become possibly a tool for easing anxiety, for reducing depression, for helping patients when they face difficulties, and as also to come with cost-effective results, health outcomes as well as cost-effective outcomes. You are muted, I can't hear you.
I think that's what everybody likes to hear. Effective, but also doesn't cost much. Good.
Well, the actual digital film, so the actual, digital product could be reasonably expensive, but we need to see that in relation to how much money it will save from NHS. If, for example, that kind of work could affect the recovery of patients. So instead of spending a certain amount of time in hospital and they could go home feeling well earlier, that could save them money. So it doesn't necessarily mean that we will compromise the artistic quality of the work by creating cheap videos. Or, we can go for the best. And that could be expensive, but we need to measure how that kind of investment will return with the quality care for our patients.
Sorry, I just have a last question. What will be the audience for this, apart from people who will be part of their community, healing community? What is there an audience outside of that group?
What do you have in mind? Audience outside the healthcare system?
Well, when you create an art product, a video, a digital, there is someone to watch that. What will be the audience that will be watching that?
The direct audience, if we talk about audience as the recipient of an art project outside research, then the audience could be anyone, children and young people in illness that are admitted in hospital, or those who are ill or suffer from conditions and they are at home. But when we speak in research terms, then the research participants / audiences would be those who are admitted in hospital or at least daycare units, so they have to be in a hospital environment. But in all researches, applied research, as I know from my applied theatre research in hospitals, there are direct and indirect audiences. So it depends which way you want to see it.
Thank you so much. Any other questions?
We just have a couple of minutes in any case.
Okay, so I just wanted to ask one small question to Maria Barna-Lipkowski. Well, I'm interested in it was really an interesting, your presentation was quite interesting, and I want to know something more about being actually hypocritical and doing a self-promotion at the same time, but feeling as if you are doing some sort of real political work. I think it's like some sort of simulacrum that we have never seen before. So I'm not sure if I'm mistaken, but I'm interested in your views about that, because I think that it's something which is potentially quite problematic for democracy in general.
Thank you for your question very much. I mean, you are kind of right. So that was supposed to be implied in my wrap up, which was kind of too fast for me to make out that point. So I think it's important. I mean, the performance and simulacrum have a lot to do in common, and you can say that the performance is kind of the concept of performance as the world is an elaboration of the simulacrum. What we need to omit from performance, I think, from thinking about performance, is that it doesn't necessarily mean that something is fake. So it doesn't necessarily imply that I am not actually feeling or doing. That's why it's different. And also the simulacrum implies the same. So it kind of says in the beginning of simulacrum and simulacra that to simulate means to actually feel the real symptoms of an illness. It doesn't mean that you do not feel anything, you're lying. And this is similar in performance. So it's hard. I always find it very hard to say, like, on the matter of feeling, like, do we really, like, is it just that we are faking it for the camera and for the audience or not? But what it actually does, and I do agree with you on that, is that it makes us feel as if we are doing something whilst we are not doing anything, because action, digital action, and I think that is a very important point that I would try to make, is that, and that is important also for digital performance. So doing online is a completely different thing than what doing means in real life. And it should be treated this way. Maybe there should be a new term or a new way of thinking about it. But an action, a digital action, is something completely different than a real action. And it is also completely predetermined by the software that we are using to connect and to communicate through the digital and with the digital. So in this sense, yes, you're right. We are simulating, so to say, something, or we are taking a stance in a situation where this stance actually doesn't mean anything except our validation.
Thank you, Maria, so much. Will be me this time. Poor Maria, there's always somebody taking her voice away.
Obviously.
But I think you made your point very well.
And I know I always say everything 3 times.
Thank you very much. It was great.
Thank you so much. We need to move on now. You have a in your chat, you have a YouTube link. We have a live performance. Obviously, you can take a deserved break, but there is a live performance, and you can go and see that. And I just want to invite Maria tomorrow to my keynote that kind of complements in some way what you were saying. My keynote is about war as a digital performance in a post-truth age. And so your wonderful presentation is quite central. Thank you very much to all your lovely presentations.